Okay, so I would verify providers plan and look at the nursing care plan, maintain standard precautions throughout. Then you would perform hand hygiene and knock on the door, come into the patient's room, and you would give the privacy to the patient by closing the door and closing the curtains. And then you would introduce yourself. Hi, my name is Eun Kim. I am a student from Nevada State College. I'm a student nurse. And this is my professor Reynoso here next to me. He's going to be overseeing everything I'm doing today. How are you doing today? Good, all right. Can I get your name and date of birth, please? Okay, my name is Panda Bear, and my date of birth is January 1st, 1990. Okay, all right, I'm just going to check your wristband. Do you have any allergies? No, I don't. Okay, it says no known allergies. That's great. First, then now I'm going to put him into a Fowler position, but I put the gloves on first because the sterile gloves, you can only use it once. Like, you cannot put it back on. So we're pretending that this is a sterile field. You would have a sterile field. You would have the drape, and then you would have the drape over your patient. You would maintain your sterile field, and you would have your hands above your hips. You would raise the bed to working level, and you would put the bed rail down where you're going to be working with your patients. Okay, so you would explain, like, I'm here because the provider has ordered for tracheostomy care, which is suctioning and cleaning the inner cannula, along with changing the fenestration, the gauze out. Great, all right, thank you. Do you have any concerns? No? Is it okay if I start on with the procedure? Yes. All right, so now I'm gonna set up my equipment. So in this case, I would then open my equipment. I would perform hand hygiene again. Then I would open my equipment, make sure that this part stays sterile, the part that enters into the patient. And then the part that connects to the oxygen would go with the left hand, because your right hand is going to be, your dominant hand will stay sterile. But before you do that, you have to hyperoxygenate your patient, and you have a pulse oximeter, and you're doing your vital signs. And he's at 45-degree angle Fowler position, and then you would set your oxygen regulator to 80 to 120 for a standard adult, and that would be, your regulator suction, not your oxygen. So I would then use the ambu bag. So I've created this because we don't have one. So then, okay, I'm gonna hyperoxygenate my patient. 1, are you okay? 2, 3, and 4. Okay, good. His oxygen is good. Okay, and then we're going to now do the sterile field, and I would then put on my sterile gloves, and my right hand would remain sterile throughout the whole procedure. As I open this and take this out, make sure that it doesn't touch any areas, okay? Now this part here is gonna remain sterile, and this part is gonna connect to the oxygen, and this is the intermittent suctioning part. Now, I'm gonna go in and start suctioning. Please raise your hand if it's uncomfortable, and I'll stop, okay? All right, so it might feel a little uncomfortable for about a few seconds. Can you bear with me? All right, thank you so much. Okay, so now I am going in about 12 to 13 centimeters. Okay, and then if I feel the pressure, then I stop, pull back a little, and then I start suctioning. About 10 to 15 seconds. You don't want to be in there longer. This is, I don't have the equipment for an inner cannula or the trach. Didn't come with my kit, so I'm improvising. So I suction. Before you suction, you can also check the suction from here and make sure it works and everything. In this case, it works. So then after that, I would discard my equipment. I'm sorry, I'm kind of sweating. Okay, so all right, so I would discard of this now, and then I would take the gauze. I would then take the inner cannula with my left hand, and this would have a thing where you can just clip it, but this is just a straw for demonstration. And then I would have this already with solution, sterile water. I would clean it with this. It doesn't go in, but I would clean it inside and out. I would rinse it with clean water, make sure it's dry, and then I would insert it back in and keeping everything sterile. Okay, so that would go back in, or I would replace it with a new one. And then I would take this off and start cleaning. Okay. And then discard of that. Then I have all these things set up already ready. So this, you know, let's be saying that this has already been soaked, and the Q-tips as well. We would then clean around this area. Okay, I just improvised and clean under the area and around. Okay, and over the area. You can use two Q-tips about, and I would discard of that. Get another one and soak it into solution, and then, you know, clean it in that area again, and lift that up and clean it up. Okay, and then discard of it. If there's more gunk, you would also use this to be able to soak it and clean around it and make sure it dries, and then you would discard of that, and now that outer part is clean. So now you would remove, right? You would remove your gloves, throw it away, maintain hand hygiene again. Okay, make sure your hands are dry. Okay, and then, okay, now, how are you doing? Okay, doing well? Okay, good. So I have it in my sterile field. I would have my new one, or I could open a new one, right? But there's gloves that come in here. So you can put on a new set of gloves, right? And then I use those gloves for practice, but you would then put on your gloves, and then you would take this out, and you would then put it there. And then you would, you know, make sure that it goes over, and then it would go under the tie. But then make sure everything is secure. This tie is still on there, so if you have a new tie, you would have a new, so keep that tie so it stays secure. Then you would put another tie over this, so that would be over here, and I would then tie the new tie securely, and so once it is all secured and tied, then you would then remove the older one so it could stay secure. So as you know, I don't have the equipment, so I'm just pretending. Okay, so that's that, and you're all done, mister. How do you feel? Okay, good. Okay, awesome. Do you have any questions for me? No? Okay, so disposing of personal equipment. Is there anything I can get for you right now? And I'll be back to check up on you in an hour. And I would perform hand hygiene before I leave, but before that I would lower the bed to the level for safety of the patient. Here's your call light in case you need me, hand hygiene again, and then I'm done.